So, did you do your exercises?
Yes, of course, I did them every day.
Really? Are you sure you did your exercises?
Yeah, I did them for the most part, yeah.
Patients not doing their home exercises is a huge problem for us as physical therapists, because the thing that helps our patients to become with less pain in their days is to become stronger and to be able to handle more of the task that they have in front of them. So when we give exercises at home, it's actually the main thing that's going to provide them to have a better day without their pain or other issues. So we don't do them just because they're fun for us to see, but actually because that is the treatment and that is how you will become better.
Do you think that an app we could monitor the user would help solve the problem?
Yes, but there is some vital criteria that has to be met, especially three. One will be that there has to be no additional hardware and an easy setup, so the system starts early, and the user should be able to complete the program without having to do any haptic interactions. And finally, it's also very important that the app will be able to recognize the exercises and also count the repetitions.
We decided to investigate the physiotherapist concerned and found several studies claiming that 50 to 70% of patients do actually not adhere to the home exercise programs. Based on this information and the therapist requirements, we looked at what technologies have been used to improve their work and found gamification, telerehab, robotics, and motion capture. Of these options, motion capture was the only one who fulfilled all of our requirements. Depending on the implementation, it can be relatively easy to set up. It shouldn't require adaptive interaction if we set up the algorithm correctly, and it should be able to identify different exercises. After brainstorming on the compliance requirements for some time, we decided to use smartphones, since this is a technology that our users already got access to.
To make a smartphone app able to detect exercise performed in front of its camera, a machine learning model was developed using video data of exercises found online. This model was imported into the app itself, which was developed using React Native. The model inputs are the joint X and Y positions of the tracked user in the image. Therefore, a PostNet model was used to convert the camera images into joint data points. This resulted in a model with 55% accuracy, which was not enough for a proper test. Instead, a Wizard of Oz test was prepared to evaluate the user experience in terms of satisfaction, usability, and concerns, as well as to investigate auditory preferences for the app.
The evaluation happened online via screenshot video and required participants to fill out a pre-survey, then perform 10 repetitions for the 4 predefined exercises in 3 transitions, after which they filled out a post-survey and participated in a short interview. The results show overall positive indicators for the feasibility of our solution. It's a satisfactory and user-friendly tool to help keep track of home exercise performance for physiotherapy. Furthermore, it shows potential for greatly improving patient adherence, with nobody showing any concern in regards to the physiotherapist actually monitoring their progress. We also found that users prefer auditory feedback. However, this preference seemed to depend a lot on the gender, in that females preferred the limited audio, whereas males preferred the extended version.